Good evening. My name is Amy Van Schack, and I am in my native habitat here at the University of Kentucky. And tonight I'm going to talk to you a little bit about the article I chose, which I found in our local Lexington newspaper, the Herald Leader. It's entitled, "Where We Die from Drug Overdoses Has Changed Dramatically in Kentucky." A little bit of a mouthful. But it just summarizes the shape of our state in regards to the opioid crisis. In 2017, the U.S. Department of Health and Human Services declared the National Opioid Crisis a public health emergency. I guess all of us in different areas of nursing have touched on how that affects us as nurses. For me, I'm in the operating room, and the patients that we get, I don't see first line or directly how they're affected. I see the results of the continued abuse. We get patients in their 20s that need a full aortic valve replacement, sometimes 2 valves, many times 3 valves, mitral and tricuspid. And the really sad thing is they seem to go right back to the opioids. These valves get infected, they turn black, and they're back sometimes within 6 months to a year for redo heart surgeries. And I have seen second time redo valve surgeries and third time redo valve surgeries on patients in their 20s and 30s. So it is very alarming to me to see the ages of these patients and the destruction that's happening to their heart and valves. In this article, it talks a little bit about mortality rates statewide in Kentucky from drug overdoses, going up 29.6 people per 100,000 ages 15 to 64 from 2007 to 2011, increasing to 40.4 people in 100,000 people for the years of 2012 to 2016. The rate of drug overdose in Kentucky is at twice the national level, and it's the second worst in the country, behind only neighboring West Virginia. So scary. As you can tell, I'm not exactly from here, but I have lived here for 11 years, and I didn't realize quite how bad our state was compared to the rest of the country. I learned that the upswing of deaths in Kentucky is driven by heroin, and increasingly since 2015 by the use of fentanyl, which is a cheap, far more potent synthetic drug that's being mixed with the heroin. The overdose rate in Fayette County nearly doubled from 22.6 per 100,000 people from 2007 to 2011. It jumped from 22.6 people to 40.6 in the next 5-year period. It goes into a little bit about individual counties. It says Kentucky recorded an all-time high 1,565 overdose deaths in 2017 alone. A lot of this was due to this fentanyl being mixed with the drug. Many prescriptions, a lot of pill mills here. It's interesting for me to hear the articles that people chose and how closely they are affected in their nursing practice by opioids. I had often done heart surgeries and valve surgeries on older people, birth defects, things like that, but it was not until I came to Kentucky that I saw the alarming number of very, very young patients having whole new valves put in due to continued use of opioids. So it is something that I see, on a daily basis here, and I find it real interesting, all the different areas that my classmates have been affected by it as well. For my non-opioid pain management strategy, I chose exercises. I chose exercises as it relates to low back pain. I know for me personally, just being a nurse, it's stressful and it's hard on our bodies, and it seems to help me to get a nice massage, makes me feel a lot better. I think oftentimes if health insurance covered massage more readily, many people would choose that. I know I would, versus taking pain medication or an ibuprofen or something for aches and pains. And I think it could be at least a second line defense for people who have a lot of low back pain, different pain, body pains, trying to get off opioids. This is my teaching plan that I chose, and this is the handout that I made. This is entitled Exercises for Low Back Pain. Staying active is the #1 treatment for low back pain. In addition to staying active, different exercises are recommended. Massage is up there as #1. Spinal manipulation, seeing the chiropractor, acupuncture, yoga, swimming, walking, and Tai Chi. If you have low back pain, it's important to see a doctor to rule out red flags before starting an exercise program. They will help rule out anything that are red flags, such as cancer, axial spondyloarthritis, vertebral fracture, vertebral infection, and cauda equine syndrome. I didn't want to distract people with that, but I wanted them, if they were having severe pain, to be able to see a doctor first and make sure that they had an approved exercise program before starting. Things to know: stay active and exercise within your limits. Consider an exercise program on a daily or every other day basis. Consult your doctor for an exercise program. And it takes time. Remember, it takes time to recover, and be patient. Nothing happens overnight. If you can, stay away from non-steroidal anti-inflammatories, muscle relaxants, unless doctor prescribed, which is kind of what we're talking about here anyway, keeping people away from the opioids. My targeted audience for my presentation was to be 10 minutes, and my audience was age 18 and older. They are being treated in an outpatient clinic for low back pain. My patients were split up into 2 groups: those having acute low back pain less than 6 weeks in duration, and those patients that had low back pain for more than 12 weeks. Opioid narcotics have limited use in very select patients, and are not recommended, like I said before, along with the non-steroidal anti-inflammatories and muscle relaxants. Although that had been a first-line treatment for many years in the past, current and future-based evidence shows that research does not recommend their use. They recommend these patients staying active. They had patients stay off work, get off their feet, bed rest, medications, and that's not recommended anymore. It's better to stay active and keep the body moving. My cognitive objectives: I wanted my patient to describe 4 types of exercise that would be beneficial therapy for their low back pain by the end of the presentation. My patient would be able to recall which therapies were most recommended. Effective by the end of the presentation, patients will be able to list 5 to 10 exercise therapies that are recommended for low back pain from my handout. The patient will state 3 therapies that they then will choose to pursue for themselves, that they think that they can handle. Psychomotor: the patient will describe and discuss 1 exercise that will fit into their lifestyle, and then we'll start a program with this chosen exercise. The patient will perform chosen exercise with maximum guidance and accept a handout to take home on their chosen exercise. Evaluation, when the patient comes back for a second visit, we'll do some teach back. So I'll have the patient relay back to me what exercise they chose, how they're going to perform this exercise either at home or at a facility. I will have them teach back to me what forms of treatment for low back pain are no longer recommended. Bed rest, staying in bed, not being active, using anti-inflammatories on an extended basis. Effectively, learning will occur if my patient is able to list exercises which would be appropriate for their low back pain and identify which they will pursue. And I will know that learning has occurred in my patient when they can, at their second visit, demonstrate the one exercise that they chose, and teach back to me from the handout I gave them on why this particular exercise will help them with their low back pain. This is my presentation handout, and I have shown my handout on exercises for low back pain. I hope that you have enjoyed this presentation, and I look forward to viewing more of yours. Thank you very much, and good night.